Okay guys, welcome. First video about hygiene. I just think it's fitting, because it's the first thing you do when you arrive at the hospital. For anyone interested, well, the topic's giga ass and sucks balls to cover, but I'll be covering it anyway, even though it's short. I am just going to mention the reoccurring themes and topics in this video. I'm not going into detail because obviously the video is too short for that. If anyone even wants to get into that topic, please make that request, and I will talk about that in detail, actually, without shit posting or brain rot in the video. But let's get into it. So, hand hygiene is what everyone's yelling about, is what everyone's talking about and no one's doing. 5 moments of personal hand hygiene before you touch the patient, after you touch the patient, after you touch infected material, and before you need to touch clean materials for which will be going to the laboratory or something. So how do we actually do it? We wash our hands. Wow. Never could have thought about it, but we wash our hands in a specific way. If we are talking about the operating procedures, operating room, surgery room, whatever the fuck you want to call it, is the surgical hand disinfection. 3 minutes long, where you have to rub your hands together like a bitch. Anyways, you rub between your fingers, everything's all right, 3 minutes, and then you're ready to scrub in. You need to be, if we're still going into that direction, if you're going for very strictly big boy operations, where you, well, let's say you're punctuating the lumbar space of a patient, where you have to, what is it called? The lumbar fluid, basically. Or you're going into surgery, really any surgery. You have done the surgical hand disinfection, you put on your gown, and let's talk about how materials are supposed to be given to you by the scrub nurses. They're not allowed to touch them directly, so the one is being unsterile, one's completely dirty, the other one is sterile and is supposed to take that out of the package and give it to you. So yeah, I'm sorry, hygiene sucks ass. This topic isn't even fun to cover, but I thought let's start with it. There's also very specific instructions on how you should put your surgical gown on and how to, well, put on these latex gloves. But who the fuck cares? Let's just get into... I thought we will cover the catheters because, well, everyone's thinking, well, medicine's sort of cryptic, medicine's sort of creepy. I don't blame you for that, because if we were to talk about it, what the catheters are, it's basically hollow tubes inserted into the body of our patient here. So you have your IV catheters, probably the most common use for them. You can use them for fluid substitution. You can use them to administer medicine directly. So this would be the direct approach, is to just, do the old Chicago special fent fold and insert it into the patient's veins instead of painstakingly giving them tablets or pills, which will arrive their blood system after, what, 40-30 minutes, and a big part of them would go away if you do not administer them directly being, of course, with intravenous. So yeah, the different kinds of catheters, let's talk about that. Excuse me. So you have ICU patients, right? Multiple catheters, dialysis or IV medication. Urinary catheters is what everyone's thinking about, right? Those things that go into your urethra, not very fun to be on the receiving end of. But if you're a bed-bound patient, that's your only option at this point, unless you want to wet the bed, and which of course does contradict the earlier part we have talked about, this earlier part being the hygiene part. Let's talk about the peripheral IVs. It's basically short catheters. Already told you about the purpose of them. Let's talk about arterial catheters, basically the same thing, but for the arteria. Suprapubic catheters. All right, this is fun. Not for the patient. Because once you fail to once you fail to give a patient a catheter, it's your only option at this point is to punctuate their abdomen and go into their urinary bladder with a stiff catheter, which, well, you are supposed to be doing with narcosis, because it's, well, painstaking, and it's kind of a small operation right there. But the basic principle is a flexible hollow tube inserted into a space in your body. You have medicine flowing from an IV bag, or your fluids, for that matter, flowing out of you. Well, that's the basic usage. Let's talk about cardiac catheters. They can be used to place stents. It's basically what's you use in the first line to prevent or to treat a heart attack by dilating the coronary. Oh my god, I am just... Well, let's just say it was not a good idea to start with catheters and hygiene. Maybe I should have started with human anatomy. Basic anatomy would have been better. I think I have the idea for the next video then. Yes, all right. So a very big field of action for those parts. Getting IV nutrition, heart patient waking up after a stent procedure, dialysis, well, from the people that cannot filter all the shit from their bodies. Call to action, fucking dog shit video. I will not be making something in this format again. Yeah. I will go with human anatomy in the next ones, because this one's was completely dog shit, sorry, but if you watch this, thank you for farming my advertisements numbers, because I'm doing it for the money. Thank you very much. See ya.